Trump's major legislation, your wallet, healthcare, and more in the balance. Hold on to your seats, because a seismic change has just moved through Washington. Congress approved a whopping $3.4 trillion package, brimming with new tax incentives, spending reductions, and increased funding for defense and immigration. But this monumental bill isn't without its critics, especially when it comes to the alarming $4 trillion that it may add to the national debt over the next 10 years. This extensive legislation has implications for virtually everyone in the United States, influencing aspects from tax deductions to healthcare coverage. Let's break down the most significant points. Tax changes, a benefit for middle-income seniors. One of the most notable tax benefits in the new bill is a significant deduction from middle-income seniors. $6,000 for individuals over 65 earning up to $75,000 per year, and $12,000 for couples with similar earnings. This deduction diminishes as income increases and disappears entirely for singles earning more than $175,000 and couples surpassing $250,000. Healthcare. Medicaid's unsustainable cuts. While Medicare is a lifeline for seniors' medical expenses, it doesn't include long-term care. Consequently, many older adults lean on Medicaid, the federal program for low-income health coverage, which now faces sweeping reductions. This might lead to the closure of some nursing homes and a reduction in services, making it challenging for seniors to secure suitable long-term care. For families, new benefits and restrictions. Families with children will see several updates, including a new $2,200 per child tax credit that adjusts with inflation, and a $1,000 tax-deferred account for children born within specific years that parents and others can contribute to. Adoption tax credits also increase to $5,000, and small businesses can benefit from expanded parental leave and workplace daycare programs. The tax landscape, shifting the benefits and the burdens. The bill preserves temporary tax cuts from Trump's first term and raises the standard tax deduction. It also continues the reduced tax rates from 2017 and introduces larger deductions for charitable contributions, even for those who do not itemize. Specifically, families not receiving government assistance will largely benefit from the new deductions, especially in states where they can deduct more of their local and state taxes. But what's controversial here might be the stark contrast between how these changes predominantly favor wealthier households compared to the challenges faced by those in the lower income brackets. Healthcare overhaul. New work requirements. Medicaid undergoes historical changes, including $1 trillion in cuts and an influx of new work and reporting requirements. For the first time, able-bodied adults between 19 and 64 must provide proof of working, volunteering, or studying at least 80 hours a month. While exemptions exist for pregnant women and disabled and caregivers, the raft of new documentation requirements could ultimately prevent many from retaining their coverage. Imagine the headaches on potential coverage loss when states must recheck eligibility every 6 months starting in 2027. The controversy over tax breaks. Here's the twist. Those on higher incomes reap the largest tax reductions, with the wealthiest 20% pocketing the lion's share. Some may see this as a step towards more economic inequality. Do you think this fuels the debate about fairness and tax policy? Share your thoughts below. In conclusion, it's clear. The new legislation reshapes various aspects to financial life in America, offering notable advantages while imposing certain limitations. As these major changes take effect, understanding their impact on your personal finances and healthcare will be essential for adapting to the evolving landscape.